Have you ever wondered why some women look pregnant, even when they're not? Imagine bleeding for weeks, feeling constant pain, and being told it's normal. Millions of women are silently living with tumors called fibroids. They aren't cancer, but they are life-altering. Fibroids are abnormal growths in or around the uterus. They range from the size of a seed to the size of a watermelon. And the scary part is, many women don't even know they have them until the symptoms become unbearable. For some women, the first sign is heavy bleeding, not just normal periods. We're talking about soaking pads every hour, passing large blood clots, feeling weak, dizzy, exhausted. Imagine losing so much blood every month that your body becomes constantly tired. That's the reality for many women with fibroids. Others experience severe pelvic pain, a constant pressure in the lower stomach, like something heavy is sitting inside the body. Some women struggle to bend properly, walk comfortably, or even sleep peacefully. And when fibroids become very large, they can press against nearby organs. That means frequent urination, constipation, bloating, and sometimes a stomach that keeps growing bigger. Many women are even asked, "Are you pregnant?" when they're not. There are also different types of fibroids. Intramural fibroids grow within the muscular wall of the uterus and are the most common type. Submucosal fibroids develop beneath the inner lining of the uterus and are more likely to cause extremely heavy bleeding and fertility problems. These are also among the fibroids most likely to require surgery because they disrupt the uterine cavity. Subserosal fibroids grow on the outer surface of the uterus and can press against nearby organs like the bladder or bowel. And pedunculated fibroids grow on a stalk, almost like a mushroom attached to the uterus. If that stalk twists, it can suddenly cut off blood supply and cause severe pain that may require emergency surgery. But here's where it gets even more emotional. Fibroids can affect fertility. Some women struggle for years trying to get pregnant without realizing fibroids may be interfering, depending on their size and location. Fibroids can block the fallopian tubes, distort the uterus, or make implantation difficult. So what actually causes fibroids? Doctors still don't know the exact cause. But research shows that hormones like estrogen and progesterone can stimulate fibroid growth. That's why fibroids are most common during reproductive years, especially in women between their 30s and 40s. Family history can also increase the risk. If your mother or sister had fibroids, your chances may be higher. Obesity, hormonal imbalance, early menstruation, and even chronic stress may also contribute. And studies show they are especially common in African women. Now here's something important. Not all fibroids need surgery. Some are small and harmless. Some don't cause symptoms at all. In fact, many women live normal lives with fibroids for years, but when they become painful, grow rapidly, or affect fertility, treatment may be necessary. Doctors usually diagnose fibroids through pelvic examinations, ultrasound scans, MRI imaging, or hysteroscopy. Medications may help control heavy bleeding and pain. Hormonal treatments can sometimes shrink fibroids temporarily. Some fibroids also shrink naturally after menopause, when hormone levels decrease. There are also minimally invasive procedures that block blood supply to the fibroids, causing them to shrink over time. And in more severe cases, surgery may be needed to remove the fibroids. Some women undergo a procedure called a myomectomy, where only the fibroids are removed while the uterus is preserved. However, even after removal, new fibroids can sometimes grow back later. Others may require a hysterectomy, which removes the uterus completely. Treatment depends on the woman's age, symptoms, future pregnancy plans, and the size and location of the fibroids.